we should be implementing precision medicine in pancreas cancer now. Although variants that are currently targetable in pancreatic cancer are rare, and I certainly understand it's frustrating to send sequencing on all these patients and never, and often not find something. The truth is that we are rapidly expanding the number of patients who might have a precision oncology option, meaning a targeted option. Right now in the germline setting, we have targets for patients with BRCA and PALB2 variants. There are studies now for patients with ATM variants and other germline variants. In the somatic tumor setting, we have targets that are either actively in trial or actively being studied and look really exciting. So patients with NTRK fusions have a drug, patients with NRG1 fusions, it's being studied, patients with BRCA or PALB2 somatic variants have drugs. Patients with BRAF variants, there are more, and patients with KRASG12C variants are now targetable. So if you don't test somebody in the metastatic setting for somatic and germline variants, and certainly germline variants for all comers, you're going to miss things. You are going to miss potentially targetable options. So it's really critical that clinicians think about somatic sequencing for those patients. The other really important point to make is that you have to know what's on your panel. So when you send a somatic panel, different panels have different genes that they test and don't test, or different specs, different things they do and don't do. You need DNA for a lot of the variants. You really should have RNA. This is best for capturing fusions, which again, there are now targets for. And you should have IHC also for HER2 and things like that. So panels that don't include all those things, you might have to order separate things just to make sure that you capture every possible drug and every possible option for your patient. So, I believe that at this moment, we have rare but real patients who would benefit from targeted therapy. I think as the KRAS story plays out specifically, as we start to develop more drugs for more commonly mutated KRAS variants in pancreas cancer, which is a very active area of exploration, ultimately, if we're successful there, pancreas cancer might become one of the more targetable diseases rather than one of the least. So I would say we're ready for it now to start testing because we have some drugs, but hopefully that's going to just ramp up as we go forward.